HIPAA stands for the Health Insurance Portability and Accountability Act. It provides the ability to transfer and continue health insurance coverage for millions of American workers and their families when they lose or change their jobs. It also mandates industry-wide standards for health care information and the protection and confidential handling of protected health information. Some steps to avoid HIPAA violations include caution with routine conversations, not discussing patients in public areas, properly disposing of patient information, not gossiping, and not disclosing PHI without permission.
So there are some exceptions where you can break HIPAA, and these exceptions are to comply with a court order or court-ordered warrant, subpoena, or summons issued by a judicial officer or a grand jury subpoena. To respond to an administrative request, such as an administrative subpoena or non-judicial investigative demand, or for purposes of identifying or locating a suspect, fugitive, material witness, or missing person. So the repercussions of breaking HIPAA. You have 4 potential outcomes. The violation could be dealt with internally by an employer, you could be fired, you could face sanctions from professional boards, and you could face criminal charges which include fines and imprisonment. The factors that determine your punishment are the nature of the violation, whether actions were taken to correct the violation, whether there was malicious intent for personal gain, and the harm caused by the violation, and whether there was knowledge that HIPAA rules were being violated, or by exercising due diligence, it should have been clear that HIPAA rules were being violated.
Some example situations of HIPAA are employee dishonesty and lack of training. Employee HIPAA training is a requirement of the HIPAA law. All staff members must be well trained on the law, as well as on the particular policies and procedures set forth by your individual practice.